Well, the widow of a Mount Carmel patient blames Dr. William Husel for the death of her husband. Her testimony included moments of pushback against Husel's defense team, who have claimed his medication orders were meant for comfort care for critically ill or dying patients. Husel is on trial charged with 14 counts of murder. Chief investigative reporter Bennett Haberly joins us now live from the Franklin County Courthouse with the latest. Bennett?
Yolanda, jurors today heard from 3 additional witnesses, including the widow of one of the patients who laid blame with the doctor and the hospital for what she says was causing her husband's death. Christine Allison has a pending wrongful death lawsuit against Mount Carmel Health System and Dr. William Husel, alleging that the dose of fentanyl given to her husband Troy was excessive and hastened his death. During cross-examination, Husel's defense team focused on that lawsuit.
Because you have a vested interest in this case, do you not?
He killed my husband.
And I realize that's your belief.
No, it's not my belief. That's what happened. I was there. You were not.
Right. But actually you weren't there, because didn't you tell this jury that there was a curtain closed?
I was still there.
Oh, now you're inside the curtain?
No, I'm just saying I'm still there. There's a curtain between us.
Okay.
I didn't see you in the hallway. Didn't see you there.
Defense attorney Diane Menashe said that Troy was given a poor diagnosis in the ER, was placed on a ventilator in the ICU, and that Christine stands to financially gain from her lawsuit. Mount Carmel Health System has already paid out more than $20 million to families of other Husel patients.
Oh, is it going to bring Troy back?
No, that's not my question. Would it help you financially?
It would help anybody financially.
Okay.
But it's not going to give me what I want.
Jurors also heard from the son of another patient. Husel's defense team alleges that many of these patients were in poor health and that it was the removal of life support, not Husel's drug orders, that caused their deaths. Prosecutors argue otherwise, calling the large orders of fentanyl excessive and alleging they accelerated the deaths of these 14 patients. Expert witness Florida critical care Dr. John Schweiger testified that ICU patients need to be monitored for days, not hours, before determining their survivability. Later, he said drug orders should be smaller and judicious when removing breathing tubes and ventilators.
If you overshoot, you're going to cause the rest rate to go down, and maybe to go to 0, which of course would then result in a rapid termination of the patient's life.
Now, again, tomorrow we're expecting the testimony of Dr. Schweiger to continue. Prosecutors had hinted last week that they could be close to wrapping up their portion of the case. That would mean it would be the defense's turn soon to call their own list of witnesses. Again, they've contended that these doses were about comfort care and preventing suffering. Reporting live inside the courthouse, Bennett Haberly, 10 TV News.